This is my peer review video for Candace. Candace, you performed all your initial tasks, such as washing your hands, providing for privacy, checking the patient's chart, IDing the patient with 2 identifiers, and introducing yourself. You auscultated before percussion and palpation, and you did a good job of describing your findings from auscultation of bowel sounds and abdominal arteries. Make sure during your initial encounter that you use the PQRST to assess the patient's pain. Also, I noticed that you didn't perform the skin and hair assessment, which can provide important information of the patient's health, such as whether they're dehydrated by checking the skin mobility and turgor, or if they're receiving enough oxygen or blood flow through checking the patient's skin color. During auscultation, you listen to the top 2 quadrants first and then the bottom 2. In your final video, you should follow the large intestine clockwise, starting in the right lower quadrant. You got most of the abdominal arteries, but I noticed that you did miss listening to the femoral arteries. And then when performing percussion, I noticed you pushed on the abdomen rather than tapping your finger over the area you want to percuss. This produces a sound that you can tell whether there are masses or fluid where there shouldn't be. And finally, you should try to collect subjective data at the beginning of the assessment rather than in the middle of the physical assessment. Because that information that you can collect can be used to sometimes explain abnormal findings, or if you need to do more thorough assessment in areas. But overall, I thought your video was really good.